time was when fat kids were thought of as healthy and adorable because their cheeks are so chubby that you want to pinch them.
But cuteness aside, there's that danger of crossing the line of being fat and obese.
So how do we treat and manage this condition? All we need to do is ask.
Because as patients, the more you ask and talk, the better we doctors can help you. Your health depends on you and me. I'm Dr. Oyi Balburias.
And I'm Maricel Laksa Pangilinan, and it's time to Talk to Doc. Okay, Doc, this is a personal question. Were you ever chubby as a kid?
I think for a short time lang. Like, I remember being 5 years old or 6 years old siguro. Yung nakukurot-kurot ka.
Kasi you're cute.
I think so.
Okay, but how come there are skinny children who gain weight uncontrollably when they reach the adolescent stage?
Actually, hindi lang naman during the teenage years yun. Kaya lang mas nagiging issue during the teenage years because they're more conscious, no? Pero iba, even younger pa than that. And of course, during the teenage years, they have more freedom. They can choose the food that they will eat. So, nagkakaroon na ng, nagiging issue na siya. Nakaka-contribute na to.
Yeah, that's very interesting. Lalo na ngayon, yung pinopromote kasi dapat sexy and lean and everything. Now, here's the story of a child who at 13 years old tipped the scales at over 170 pounds. Miguel Paje is not the ordinary 13-year-old adolescent when it comes to physical appearance. At his age, he was diagnosed as overweight, and this led to other conditions and illnesses.
I was pre-diabetic. I was close to becoming diabetic if I didn't lose more weight. I noticed that whenever I climbed the stairs, after just one floor, I was tired already. And then, whenever we ran the track in school, I was always, the class was in one group, I was behind with other people. So, I wasn't really that athletic. I didn't really excel in sports and other physical activities.
He's always had this self-confidence, mataas yung self-esteem, no? But yeah, that was my problem before. He was always with me. He's always with me when we go shopping, wherever. And he easily gets tired.
These experiences led to Miguel's decision to eventually lose some weight.
No, I wasn't really embarrassed. It wasn't, kasi no one was really teasing me like, you're fat, no. It was just me. I was the one who decided to lose weight, to become a healthier me.
He was evaluated by a team of doctors led by Dr. Maria Cristina Tanbonlyong, and he underwent a weight loss program at the Adolescent Wellness Center of the Medical City, which involves a 3-month intensive and 3-month maintenance phase program.
Everything was explained to me and my mom properly before I underwent the program. And then they told me what would happen to me if I didn't undergo the program and what would happen to me if I did. They gave me options on what I can do. My endocrinologist told me that I should lessen eating red meat, and then my dietitian helped me process what I ate for the week, and then she told me what I should lessen, what I should add, and then my physical therapist told me that I should not just sit down at home and watch TV. I should also be more active at home, not just here in the hospital. It was a bit hard at first, but I got used to it because they don't just make it hard kaagad for me. They increase the hardness of my physical activities every month, depending on what the physiatrist says.
It's a holistic approach, okay, from psychological to physical to clinical. Parang ganun. So I said, this is the center I'm looking for my kid. And you won't get scared, like they'll give you a faddish diet of some sort. Ito hindi. It's really properly guided. And they're all very encouraging from the very start.
His 6-month program with Dr. Tan Bonlyong ended last April, From 170 pounds, he is now 10 pounds lighter and has improved his endurance.
But you know, like a few months after, no, maybe a month pa lang after the program, wow, he was walking faster than I was walking. Now he walks faster than me in the mall, so without complaining. So
I feel lighter. I don't get tired as easily anymore. And I feel much healthier than before. I can cope now with what my classmates are doing. When they saw me, they just, "Oy, you lost weight." And that actually made me feel happy.
It's interesting to note that it was Miguel himself who wanted medical help.
That's right. Instead of taking his situation for granted, Miguel took a proactive stance. And usually a medical intervention is so much more effective if the patient himself desires to be healthy and well.
We'll have to pause for a break right now, and when we come back, we'll talk about weight management for children.
Stay tuned. Talk to Doc will be right back.